Well, welcome, Dr. N.
Thank
Otherwise
you.
known as Naya. How do you want people to know you? Naya, Nether? Dr.
I'm
N?
Dr. Netherland Joyner. Many people call me Dr. N because it's a lot shorter. So there you
Awesome. Well, welcome, Dr. N. She's going to enlighten us about the glories and everything that is great about being a chiropractor.
go.
So
Yes,
start with just yourself. Tell us a little bit about yourself. What do people know? Do you have an athletic background, correct, as
I
well?
do. I do. I competed in track and field in college. In high school, I did tennis and track, and then past gymnast, dancer. So yeah, definitely athletic back.
Everything.
Yeah, a little bit of everything. Yeah.
Okay. What made you go into being a chiropractor?
So originally my mom was, well, she's 22-year Desert Storm Army veteran. When growing up, she had a lot of back problems, a lot of pains, a lot of injuries sustained from her time in the military. So it was really hard when I was like 13 and she could barely walk to the mailbox. And it wasn't until she started seeing a chiropractor that I got my mom back. And she now plays golf and 20-mile walks with her friends. And yeah, she's
Very
she's my
active.
hero. So it was a pretty done deal. And then it was solidified when I had a car accident when I was in high school and couldn't run track my senior year of high school, which was devastating. But with chiropractic PT, was able to get back. So
So you
it was
saw it firsthand and secondhand in
exactly.
yourself and other people.
Yeah, yeah, yeah.
Well, so if it works for you, it can work for other people.
Right, exactly.
Yeah,
It's
that's kind of the general idea that got me into fitness as well. Like, again, it made a big impact, not only physically, but
mentally.
psychologically. It gave me a
Yep,
lot more confidence to do pretty much everything. So there's a lot of power to share that with other people.
agreed. Agreed.
All right. So that being said, we know all about you. So what exactly is a chiropractor? Like, what do you think people should know about that?
Yeah.
Because I feel like a lot of people, they see the YouTube videos or like
Mhm.
the Instagram reels, and it's just the snapping and the crackling and the pops.
Yeah.
So let's go into that a little bit. What is being a chiropractor?
What is a chiropractor? So, first and foremost, we are primary care physicians. So, we learn everything a medical doctor learns except for surgery. So, we don't do surgery, we don't prescribe prescriptions, but we do know about the body and we assess your central nervous system. We're neurological based doctors because that central nervous system controls every aspect of your body from muscle to tissue to ligaments to digestion, organs, all the functions. And when your spine is out of line, it can impinge on the central nervous system. So our job is to make sure it's in line so you can have optimal function in your daily life. And that's
Yes.
the run of the
And then
mill.
just in case the people don't know, again, central nervous system is brain and spinal cord, and then
Yeah,
your peripherals, pretty much everything else outside of that, correct?
you got
So
it.
a lot of the focus that you do is in line with
Yes,
brain spinal cord. Okay.
that's right. That's right.
Okay. So why would a person seek a chiropractor versus a physical therapist versus a medical doctor? Like
Yeah.
how does that system work?
Yeah, so that's a great question. I think the main reasons is we see a lot of overuse injury, right? So if
Okay.
you're working at a desk at for the main hours of your job and you have poor posture, that can impinge on that central nervous system, causing those dysfunctions later down in the body, like you were talking about peripherally. But yeah, I think everyone can see a chiropractor. It's really important to make sure that that aspect of your system is clear so then you have optimal function. In terms of when to see a chiropractor, I think everyone should be seeing a chiropractor regularly, preventatively. It's kind of similar to PT in that regard. If you do your exercise early, maybe you don't have those injuries, right?
Mhm.
But at the same time, if something does occur, you can go the reverse way of, okay, well then we need to make sure that you come in and get taken care of. So they're all,
Okay.
they're all necessary. Medical
Yes.
maybe more an emergency state. We're preventative, but also can handle some overuse injury, some sustained chronic pain kind of issues that you have, restrictions, things like that.
That's an excellent point to bring up about the prehab versus the rehab, because I
Yes.
think that's in a lot of people's minds where I think the whole chiropractic thing is more, I have the problem already. How
Hmm.
can Dr. N fix me?
Hmm.
So I guess me personally also didn't even think about using it before as a prevention type tool.
Yeah.
So what would be like an example or some examples of what people can do or what you can help people with before there's even these problems?
Yeah. So I see patients as young as 1 day old, right? So there's a
One
lot of
day
trauma
old.
that occurs with just birth in itself. And if that can, create a misalignment. That's what we call, what we look for, misalignments in the spine, where it's not like, it's kinked or there's like a scoliosis happening, nothing like that, but it's just
Mhm.
a millimeter or two enough to where you're causing dysfunction, whether that's in a kids, you often see like ear infections, right? Or they'll have a lot of colic, or they'll be just very disturbed, whether it's like regurgitation, different things like that. So
Okay.
early on, great. If you're someone who, maybe you had a really bad fall, there you go. I mean, there's things in our life, whether that, like you said, emotional stress, physical stress, things that occur that we're always having to adapt to. So if you're coming in prior to those things occurring, it just helps your body adapt to those things even better. Does that make sense?
Okay. It does. So
Okay.
if someone walks into your office, visits Dr. N inline,
Mhm.
as a preventative tool, you can basically do whatever assessments that you do and identify some of those things that people might not even know is
Yes.
happening, like
Yeah.
those millimeter misalignments and things like
Right.
that.
That's right. Exactly. Exactly. And it can
Nice.
show up whether it's, energy, your energy's feeling low, maybe you don't get a great night's sleep, just different thing. It can personify itself in many avenues, but just making sure that spine is in line just helps you clear those things out before they become a bigger problem, before, you have something to really worry about. Yeah.
There we go. So we have to reach out to Dr. N here, which we will provide her information. So don't wait until there's that problem.
Oh, wait.
So in the past,
Mhm.
we had someone here at the fitness center asking you about she would frequently pop her hip,
Mhm.
not in a weird, painful way, but it's kind of like cracking knuckles. She would pop her hip. And then
Mhm.
you brought up this interesting point where in a way you kind of told her it might not be the best idea. Can you go
Yeah.
into that a little bit as well? Like why
Yeah.
would those
Mhm.
self adjustments, let's
Yeah.
call it, why might not those be the best
Right.
idea to do?
Yeah, so oftentimes when we're cracking our knuckles or our hips or our necks, please don't. But if you are someone who's doing that, what's generally happening is there's gasping release from the joint, and that's the cracking noise that you hear, what we call a cavitation. But when you're doing that, it's actually an area that's probably already lax and not getting to the specific point that's restricted that needs to be released. So those restrictions and your feeling of pain or discomfort are actually being addressed. So really you're cracking around the area instead of the actual point that needs to be adjusted. And that's where I come in, right? So we're here to assess, we're here to adjust the specific areas that you need so you don't even feel like you have to do those self adjustments.
See, and that's very good information because when people do that, they might feel that relief in that moment,
Right.
but then whatever the next day or the next week comes by, and then they go right back to where it was
They go right
before,
back
and
because
that
it's
could be part of the reason in
yes.
itself.
Yes, exactly.
So
Exactly.
again, very good information to know. So let's say a patient comes to see you, Dr. M.
Mhm.
If they need adjustments, you do those adjustments. So when they're on their own, so
Mhm.
things don't go back to where they
Yes.
were before, how does the exercise component fit in? Like, do you prescribe exercises? Do you show them? Like, how does that work at your office?
Absolutely. And honestly, Matt, I know this is where you come in as well, is where you can see how doing just small exercises to support the area, right? So we're looking at the spine, we're looking at the central nervous system that lies within that spinal system. So the muscles that surround it are then really important, because if you're not addressing those muscles that are hypertonic or really tense, they're going to keep pulling on those areas, creating those misalignments. And that's the pattern. So we're here to break that pattern from a spinal standpoint, but then also a recovery supportive standpoint, getting into that neuromuscular area.
Yeah,
So
because it's something we definitely see at the fitness center. I was just talking to someone recently where he was talking about his bench press.
mm-hmm.
And then he said, "Oh, one shoulder always feels kind of weird when I do bench presses." So I kind of saw how he was moving, and then when I saw him from the back,
Yeah.
his like one shoulder blade was like
Yep.
this much higher, and one was like in the where it was supposed to be. And I'm like, this is probably part of
Right.
the issue. It maybe not all of it, but let's just start with
Yeah.
instead of here, let's just go a little more balanced, in line, so to speak.
Exactly, exactly. And it's not something that's necessarily complicated, right? So maybe I
Mhm.
wouldn't prescribe like bench presses, but just doing simple like hummingbird exercises or working on those smaller supportive muscles around those bigger ones to make sure that you're moving properly. Yeah,
Those are the ones that don't get enough credit, those types of
yes,
exercises. Because
exactly.
people just, again, they think it's a physical therapy rehab thing, but again, if used within a structured exercise program, again, I feel like that totally builds that base that you
Yeah,
can build off of from
yeah,
there.
yeah, exactly. But the foundation is key. Exactly.
So we have the exercise component. Like, how does or does nutrition fit into this? Like,
Yeah,
like, would proper eating help with just
yes.
general recovery, or is there specific things that you can do to
Yeah.
help certain things, perhaps?
Yeah, so I guess backtracking a little bit, there's three areas, we call them the three T's that can cause a misalignment, right? Causing that dysfunction in the nervous system, which are thoughts, so your emotions, trauma, which is like physical things, whether it's overuse, your job, or a fall. And then there's thoughts, traumas, and toxins. So then what you're putting into your system, right? So having a nutritional, well balanced diet on a regular basis is great. So making sure you're getting in your greens, making sure you're having those good nutritional aspects to help your body sustain itself, having the energy levels, all those good things. Because when we don't, we know the difference when you sit down, you had that one meal, you know what you're thinking of it right now, and you're like, oh, maybe I shouldn't have done that one, right? If we're changing our system in a way where we're getting those nutrients more regularly, that can make a huge difference with decreasing inflammation, which then takes off the element of pain on those areas that you're feeling, creating just better pathways for your body and your mind. So there you go.
The three T's. I love it.
Three T's,
That's,
yes.
I mean, I like the last point that you brought up with inflammation,
Yeah.
because like the misalignments in people's bodies, I think there's low level or perhaps even high level inflammation in people's bodies that they don't even know of, or they just think it's normal because they've lived
Yeah.
with it for
Yeah.
so long. So there's a lot of foods. I don't want to say toxins, that's a very strong word.
It is.
But
It is.
there's foods that could react with your body, with your
Yeah.
specific body, that might not
Mm-hmm.
react that same way in someone else's body. So I think
Yes.
identifying these things and working with yourself, a nutritionist, a dietitian, whoever it may be, is always a good way to start to figure those things out. Because it's hard to think about something that you've never thought about before. That what is it? The
Yeah.
pre-contemplative stages of readiness.
Yeah.
We're here to
Exactly. And
prepare
that's
everyone
what
for
we
these
do here.
issues.
Exactly. And that's exactly what we do at Inline Health. We look at and educate you about your health, right? So we try to talk about nutrition. We try to look at what areas of your life that you're maybe having some difficulty with that we can maybe tweak or change that will just help you, overall in your everyday function, right? So looking at nutrition, looking at those small exercises, asking you about your stress levels. What can we do? Simple things at home, um, that just bring those markers down to where you're having a more sustainable everyday, you know, good time. essentially.
Yes,
Yeah.
and I love it. I mean, I think more more people in the health space should have that holistic approach
Yeah.
because it's so easy to just I feel like I shouldn't say easy. I feel like it's very common that instead of looking at the whole person, it's like if you have a heart problem, you see the heart doctor. If you have a digestive problem, you
Yeah.
see the gastroenterologist.
Right.
But a lot of these issues are interweaved
Yes.
where like even you mentioned like the trauma, like
Yeah.
psychological, your thoughts can affect your body can affect your thoughts. It's like a two-way
Yep.
street.
That's right.
So I feel like a lot of these things aren't addressed. So thank you for doing it and for spreading it to as many people as possible.
Absolutely. Absolutely.
So kind of wrapping it all together as well. What do you feel like people should know about seeing you, but seeing a chiropractor, getting the work that you do? Like
Yeah.
what's a take home message that you
Yeah.
can send people home with?
Take home message. First and foremost, it's not just about the cracks and the pops, right? So you see those videos like you mentioned on YouTube, TikTok, Instagram, but it's more than that. It's making sure that we feel the muscle being reduced. It's about making sure that you can reach those goals that you want to do, the bench press that you want to be able to do, right? So we're making sure those markers are being hit, not just the sounds that are being made. And there's also areas and techniques that don't even have to have sounds, right? So I use different techniques that are more gentle, if you will. All of it's gentle, but if you don't want the crack sound, I'm here for that too. We will
People
get you
love the
in the ring.
crack.
That's right. That's right. It's not about it. Crack, like Whitney Houston said, crack is whack. Okay. We don't have to have it. We don't have to have it.
Yes.
Yeah.
Wonderful. Well, Dr. N, thank you for the information. Thank you
Or
for sharing the gift of health, fitness with your
absolutely.
patients, with the community.
Yeah.
And thank you for spending a little bit of time and sharing everything that you do.
Of course. I hope we see you here at Inline Health. Also in January, we have our 50% off new patient promotion going on. So stop on in, give us a call, and we're here for you.